Good morning, America. It's Dr. Toker. I thought I would answer a question for a series of patients, actually, who have asked, and I'm going to try to make it as simple as possible. Here we are in the middle of a viral pandemic. I am not a fan of the virus, which no one is really, but our response to it has not exactly been the most stellar and scientific of responses. I'm not sure why that has veered from tried and true science, but here we are. One of the things that many doctors are doing right now to try to figure out why their patients may be sick or to prevent a patient from inadvertently making others sick is we institute tests for this coronavirus. There are a series of tests. The one that I offer is a very specific antibody test, but before I explain what that test is, you might want to know a little bit about immunology. And so I'm going to cut and splice together a little very cartoonish, rudimentary concept on what happens when you get infected by a virus. Like, how does your body respond to that? And then based on that, you'll be better able to understand how it is that we diagnose this disease and maybe what we would do to treat it. Okay, let's pretend this is a virus. It's not really to scale, and viruses don't really look that way. Don't hate. Now let's pretend that this is a normal cell. It's pretty happy, hanging out. And let's pretend, and again, probably not to scale, that one of these virus dudes lands right here on the little cell. And the cell, because he's so welcoming, takes the virus in. Well, that was a mistake. It doesn't take very long for the unwelcomed visitor to completely replace the normal mechanisms of the cell with a viral mechanism, and all that viral mechanism does is make more virus. Now, you can see the cell's not super duper happy, and it's gonna send up a couple little, and I'm not left-handed, so I apologize. I could have planned this better, but like a little signal. Lord help me, I am being held hostage. Our signal here to our getting sick patient here has sent out the crew here, an investigative unit who finds murder most foul, a dead cell, and all these purple perps all over the place. The hazmat team cleans up the murder scene, and what they do is find bits and pieces of evidence, little bits of our purple perpetrator. And that hazmat unit cell is now gonna have to go down to the medical examiner's office to figure out who the murderer is. Okay, back at headquarters, the hazmat team has evidence of the perpetrator of a murder. The CSI unit is in charge of figuring out who the heck did it and make it stop. Now, the first thing that has to happen is a sketch artist needs to come around and make pictures of this perpetrator so society knows what the heck they're looking for. These little police sketch drawings are the very earliest of response to what appears to be a viral uprising. These little sketches will go out into the body to see if they can't identify who the bad guys are. The bad guys out there who are wreaking havoc suddenly find themselves carpet bombed by a bunch of these little pamphlets, and some of them stick, some don't stick. But the ones that do stick become a signal to more of the cops. When a cop finds a bad guy with a little pamphlet stuck to him, he mops that dude up, busts him down, brings him down to the station, tells the supervisor, dude, found it. This is it. This is the piece that we need to look for. Headquarters says, awesome, make more of that. Make more of that. Then they call in the CSI unit, the plainclothes cops, Yeah, there they are. And they will actually attach that little flyer to themselves, the cell, and they are on a mission to find the bad guy. So here is the bad guy, looking guilty as hell, covered in all those kind of pamphlets. This is clearly our man, okay? That tells this guy, oh, we have our man. I'm coming to get you. Okay, so now it's on. You got the cops onto a riotous outbreak. And honestly, pandemonium does kind of ensue. This guy's calling for backup forces. It could be the dogs, it could be the helicopter, it does not really matter. He has his man who is causing destruction in the streets, and it's got to stop. In our story, one of three things is going to happen. Either the virus wins because society just cannot get its act together. There is no police force. No one's answering the 911. And chaos ensues and, no one can get together a response. That's a bad outcome. Outcome number two is the body creates a response and gets rid of the virus. But there is so much chaos in the response that it creates sort of a physiological anarchy. And ultimately, it is that anarchy that kills the patient. Well, that's a bad outcome, even if the virus is long gone. The final outcome is the patient lives. Everything works the way it was supposed to. The patient lives, but more importantly, memorizes who the bad guy is. And then also posts warning signs all over the body, constantly circulating and looking for this bad guy. He's one bad hombre. And you don't want him coming back. If he tries to show his ugly face around here, everyone's going to remember who the heck he is, what he did last time, and kick him out before he can even set up shop again. Okay, so now that you understand sort of how the body mounts a response to a viral or bacterial invader, that leads to how do we use this information to diagnose disease? We can diagnose a disease by either catching it in the act, in other words, finding the actual organism that's causing the problem. In the case of the coronavirus, that test is called a PCR test, and more specifically is called a reverse transcriptase PCR test. That's the one where they brain biopsy, because the cells that get the most viral load are way in the back of your skull, in the back of your nasal pharynx, to be more medically accurate. And they get a swab of this, they bring it to a lab, they're looking for RNA. And the way we find RNA is by adding something called the reverse transcriptase into the little test tube with a bunch of nucleic acids, and we convert RNA to DNA. Then what we do is take that sample, add to it something called a primer, and a primer is a short segment of nucleic acids that will stick to the beginning of this DNA piece, the very front part of the DNA piece, and then they add a polymerase to that with a bunch of nucleic acids, and they let the polymerase copy that piece of DNA. Then they heat up the test tube, separate all those little pieces of DNA, and they repeat the process, sort of like a Xerox machine. That's called PCR. So a PCR test amplifies DNA. This is an RNA virus, so you've got to transmit it from, or translate it rather, from RNA to DNA, and then you amplify it. And then if in your sample, you've got a bunch of DNA that is the exact DNA of the virus, then you know in your sample you had the RNA virus. Okay, so that is a very specific test. And I believe you can see how that is rather complicated. This is not McDonald's. You're not just going to drive in and get this test and have it done. I mean, that's a lot of steps. And back in the days when I used to do PCR many, many years ago, that's hours and hours, if not days worth of work. Surely they've made that faster. I think the fastest you can get a PCR test is maybe 3 or 4 hours, which is amazing, to be honest with you, as a scientist. That's amazing. Anyway, so PCR test. If you want to know if you are carrying the actual virus that you can transmit to other people, the test you want is a PCR test. But that's not the only test that we do to diagnose the disease. In fact, that test is very expensive. It takes time. And when you're talking about screening 300 million people, do you really have that kind of time and money? Probably not. So a quicker way, an easier way, and a cheaper way to look for the virus is not to find the viral particle itself, but to find evidence that the virus was there. Those little sticky note pamphlets, right, that the CSI guys were making saying, hey, this is our man. Those are called antibodies, and your body makes a variety of different types of antibodies. The most rudimentary antibody is IgM. IgM antibody is made very early in a viral infection or a bacterial infection, so very early on, the first week or two. When you get infected within a few days, you can expect to see some IgM showing up. And your body will continue to make this IgM for weeks. But ultimately, that's not the world's best antibody. You know, it's a big, bulky molecule. The body stops making IgM and instead makes a more stealth version of that called IgG. IgG, a little stealthier, a little higher tech, takes a little longer for your body to figure out how to make it. So IgG does not show up until later in the infection. So in the course of an infection, you will go from virus only to virus plus you have IgM, plus then you will have virus plus IgM plus, we're starting to see some IgG. Ultimately, you will have just some IgM and IgG, there's no virus present. And then long term, sometimes for weeks, sometimes for months, sometimes for years, sometimes for your life, there's no more virus, there's no more IgM, you're left with IgG and IgG only. Okay, so how do we use that information? When someone comes to my office, and the most common response is this, I have to go to summer camp, I was sick 4 weeks ago. As it turns out, my third cousin's babysitter's dog walker had coronavirus. I haven't seen any of these people, but they won't let me go to camp until I prove that I personally have not had coronavirus, nor am I actively infected. And I'm 12 years old, and I don't want to have the brain impaling procedure. And this is the perfect opportunity for an antibody test because it will tell us, were you so significantly exposed to this virus that you created an antibody? And if so, do you have the baby version of the antibody that's there early in infection? Or do you have the antibody that means you've been exposed a long time ago and you may or may not be immune to this disease? So that is the test that we offer. Okay, so it's called the Corona Check. It is an IgM and IgG antibody test. It is interesting, I saw some discussion about, you can't trust those tests because they're CLIA waived. A CLIA waiver does not mean the test is not real. A pregnancy test is a CLIA waived test. CLIA is an agency in America that controls all laboratories. It's our way of making sure that a laboratory, when they say you have a cancer marker, for example, is not lying to you. I mean, they're doing everything right. Their machines are working. Their doctors are reading it properly. So there's a licensing process that goes into a laboratory. Most of your doctors are not true laboratories. They can't do all of these tests, but they can run a pregnancy test, a urinalysis, a rapid stress test, a rapid strep test, or one of these corona antibodies. You do need to register with the CLIA people, but they waive all of the inspections and obligations that most laboratories are required to have. So most doctors' offices have what's called a CLIA waiver. And these antibody tests are qualified tests in offices that have a CLIA waiver. That's what that means. Does not mean it's not an FDA-approved test. Now, the FDA has put in emergency approvals, and the list is getting longer every week on which tests have gotten these approvals. And so there are some tests out there that are not yet on the list. So as long as the test the doctor is using has been inspected, and there's a number on it, a lot number, and then I think it's called an FC number or an FD number. The test has been inspected, so the FDA knows it wants to grant a licensure to that test. It just hasn't gotten through the paperwork yet. That test has an emergency approval for use. And so my test, when I got it, was on the emergency approval list, and I suspect it's on the list by now, since it's been 5 or 6 weeks. But anyway, that's what those terminologies mean. You have to be very cautious because some of these tests are fake. Like, don't go on Amazon and buy one of these tests, okay? Because you're probably not going to get a real test. Okay, so you want to go to a doctor's office. If you are sick, you're going to call ahead. Honestly, if you are ill, I suggest get the PCR test. Get the real Monty, okay? Unless you're so ooky about the swab thing that you just can't do it. Our antibody test is 90% accurate on both the false negatives and the false positives. So in other words, 90% of the patients that are negative, it truly is negative. 90% of the tests that are positive, it truly is positive. That's a 10% error rate in both directions, which is an acceptable screening test. Okay, that's an acceptable screening test. It depends on what you want to do with that information. That may be enough. Okay, so if you are exposed to the virus 4 months ago, you had a cold, you were sick, you come in, your IgG is positive. Okay, yeah, there's a 10% chance it's a false positive, but chances are you were actually exposed to coronavirus. Hey, go donate some serum to the blood bank, okay? If, however, you're about to have an operation, if your IgM or IgG are positive, we're going to quarantine you for 2 weeks. If they're negative, depending on the kind of surgery, we might not be satisfied with that. We probably are going to suggest a PCR test to prove the virus is not there also. I hope that makes sense. Okay, so people who come into my office for this test are going to get an antibody test. They are going to sign a waiver saying that they understand it's an antibody test, not testing for the virus. It's testing for your body's response to the virus, if any. If there is an IgM positive test, you are to quarantine yourself for 2 weeks. We are going to report that IgM positivity to the state. They're probably going to want to check your whole family to just do contact tracing. If it's only IgG positive, okay, who cares? You've had the virus. Congratulations. You do not need a PCR test. I suspect I do have to report an IgG positive to the state. It hasn't come up yet. So what you do with the information kind of depends on your personal situation. But if you're going to ask for this test, you need to prepare yourself for 2 weeks of not going anywhere. Because if it's positive, you've just signed a legal document saying that you are going to quarantine yourself. And then I'm probably going to call authorities to make sure that you do so. Because we're in the middle of a pandemic and it's required. If that makes sense. Okay? So now, if you need to have that information before you can proceed and go see grandma, please come in. Happy to give you that test with its known failures. All righty? But there is no perfect. That's what we offer. All right. Talk to you soon.